change. Labor contractions are going to be more regular, they're going to last longer, they become more frequent and stronger as the labor progresses. So typically these are going to be about 3 to 5 minutes apart, lasting about 60 to 90 seconds. If we're monitoring the contractions externally, we'll use a tocotransducer, which is a pressure-sensitive device that we place at the fundus or the top of the uterus. This is non-invasive. It goes on the outside of her belly, and it's going to show frequency and duration of contractions, but it's not really going to show us the strength of contractions because it's going to be dependent on a lot of different factors as to how much pressure it puts on the monitor. So for this, we'll palpate the belly to determine the strength of contractions. During a contraction, depending on how much our fingers indent on the belly, we'll call it mild, moderate, or strong. And then in between contractions, then it should palpate soft. The way that we measure contractions are going to be based on the waveform that happens on the graph. So even though we can't measure actual strength on this, we're going to look at the frequency and the duration. So each of the boxes moving left to right are each 10 seconds. And so that's what we're looking at for frequency. We look at how often the contractions happen based on when one contraction starts to when the next contraction starts. And we count the boxes to count how many seconds between those two. Duration is how long the contraction lasts. So again, counting the boxes in 10-second increments from when one starts until when it ends. And then the interval is going to be how much time between when one ends and the next one starts. And this is kind of the break in between those contractions so the mom can have a break to recover and the placenta also has time to fill. The peak is the highest point of the contraction, and even though with external monitoring it's not measuring actual strength, it still lets us know when the contraction is at its strongest and when it's starting to go away. So if we're monitoring internally, we're using an intrauterine pressure catheter, or an IUPC. And this is a flexible tube that's inserted through the cervix into the uterus, and this is going to measure the actual strength of contractions to determine the intensity during labor. And so this sits right inside the uterus between the baby and the uterine wall, and it's going to measure the strength of contractions in millimeters of mercury. And when we look at this, we assess what's called Montevideo units to determine if the contractions are adequate.